Um, this year, Deirdre Bullock is going to introduce our Robert S. Ochner Memorial Lecture.
Good morning, everyone. So it's kind of a perfect introduction because when thinking about what I was going to say about Dr. Barrett's, I thought a lot about mentorship and what that kind of meant to me. So for those of you who don't know, Dr. Barrett's is the program director for the Hand Fellowship in Pittsburgh, where Anna Green goes, and that's where Dr. Haddad's going to go next year too. And so, when I was thinking about mentorship, I was thinking about my time in Pittsburgh and how difficult it must be to create a mentorship model or a good mentorship model in 1 year. So a lot about orthopedics that you can learn in terms of skill set, but being a mentor is more than just learning the structural skills that you have to do to be a surgeon. It's about learning the type of doctor you want to become and the type of person you want to become. And when I was thinking about that, I was thinking of something we used to do. I remember it as dinner for schmucks, but that's not what we called it. We called it adventures in dining, where we would go out with someone who was non-medical and just to dinner and drinks. And it would be Dr. Barrett's, two of the fellows, and someone that one of the fellows picked to invite that wasn't medical. And you weren't supposed to talk about medicine. And, at the time I was like, oh, it's to make sure you realize that you know how to talk to people other than about medicine. But I think it's also that we get so bogged down in becoming doctors and learning how to be orthopedic surgeons, we forget there's a whole nother world out there. And to me, this lecture that we're going to have now is about remembering that there's a whole nother world out there and learning how to be balanced and learning how to be a better person. And that's what Dr. Barrett's gave to me in fellowship. I feel like I took so many lessons with me in just that 1 year about how I want to be a doctor in the future, how I want to take care of people. And I could list many accolades that Dr. Barrett's has, but the list would be really long. So instead of doing that, I decided I would just talk about what it meant to me to be there and what his mentorship meant to me. So I hope you guys enjoy this lecture as much as I did.
So it's great that this has continued for 25 years. I was watching your face, it's still raw, right? And so those are some of the things that over your career end up being the most meaningful. Ironically, a couple of weeks ago, I was at NYU for an Eaton lectureship that honored Dick Eaton's son, who had passed in a similar fashion. And it does make you look back and say, God, I really hated this week. But in the scheme of things, it wasn't that bad. And I hope I'm doing something that is meaningful to me. And that's sort of the basis of this talk. So I hope that this is as meaningful to you as it has been to me over the years. So this is Deirdre in Pittsburgh. She's wearing her colors. Well, maybe they're not her colors anymore, but oh, they are still your colors. That's a beautiful thing. That's awesome. With Sophia Leung, who was one of her co-fellows, and this was her crew. We've been we were tremendously lucky to have Deirdre. She's still one of the best trainees that I've ever worked with, and and has not called me since she graduated about an applicant, and then called me and said, "Yeah, you need to take Anna Green." And Anna has been a real pleasure to work with. She is a wonderful doctor, wonderful surgeon. She has a great crew to work with. Deirdre, it would have been nice, though, to get a heads up about the ice cream dependence. That's something that we're kind of working through right now. And we're excited to have Dan come and join us in Pittsburgh. So this title, "What is your favorite song?" which is a little goofy, is a metaphor for finding the same sustainable enjoyment in your personal and in your professional life that you get from listening to your favorite song again and again. And so I kind of think about it as sort of finding the sweet spot. It doesn't mean that you need to work less. Working more may be part of finding the sweet spot. But for each person, that little balance is going to be different. And I have to tell you that I think, in particular for you as trainees, the challenges are much more significant than they were when I started out in orthopedics as a resident. So you're facing healthcare reform, burden of added documentation, coming up with new definitions for compensation, a more frugal approach to diagnostics. Medical liability is a bigger issue for you now than it was for me as a trainee. And then the crazy thing is that when I was an orthopedic resident, there were really like 3 sources for information. If you wanted to read about a hand case, it was Journal of Hand Surgery, Core, and JBJS, and that was it. And the other beauty about literature back then is that every study had an 80% success rate. So even if you didn't read the article, if somebody pimped you on it, you get 80%. It's just sort of an automatic thing, right? So when you have all these things that you're having to consider, even other than just, you know, how I take care of a fracture, it can generate a sense of sensory overload. You can question whether or not what you're doing is worth it. Did I make the right choice? Is it too late to change? I ran the orthopedic residency at Allegheny General for over 20 years, and about halfway in, I stopped inviting faculty to dinners with visiting professors. And the reason that I stopped is that the faculty and the visiting professor would talk about, would complain about how reimbursement was going down. And I would look at the residents and I go, yeah, these guys are probably dying. Here they are working their butts off to get into this career that their mentors are complaining about. And so I worried a lot about buyer's remorse. You know, did you pick the right thing? And so one of the questions that I would ask you is, do you think that this is only because of these recent reforms? And so I want to read you something. A doctor's life is made up of moments of terrible nervous tension. There are times when the powers to continue such a life are entirely exhausted, and you're seized with such depression that only one thought remains: turn your back on all and flee. 1916. Okay. So this is not new. You have a hard job. This is a difficult profession that no one can really appreciate. I actually love some of the shows like House and the new one out, The Pit, that have shown the toll that's exacted by this career on you personally. And it is real. And so this can go from just being something where you go, wow, did I make the wrong choice, to burnout. And burnout is real. It's been studied. The Japanese call burnout karoshi, and it was studied in Taiwanese physicians. In those physicians that suffered burnout, there was no difference in gender, affected all ages. These were the categories of things that people experienced. In this group, there is a higher incidence of medical errors, a higher incidence of medical malpractice, and sadly, 7 deaths from suicide in these physicians that had experienced burnout. So is it all about the money? I think it is. I think that there are financial pressures that are hard and maybe getting worse, but it's also not just about the money. And so if you look at the history of medicine in the US, we started out basically having doctor moms. The mother of the family provided most of the medical care, and then there were untrained bone setters who were our forefathers. War has a crazy effect on medicine. And so post-war communities end up upgrading necessarily their medical systems. So for us, post-Civil War, there were municipal hospitals, there was more centralized care, and medical schools so that we had trained physicians. This was published in 1913. About 10% of physicians at the time were able to earn a comfortable living. 10%. So who was doing this? These were people that were from upper middle class backgrounds who liked science and wanted to help people. But they had to be subsidized by their families. They couldn't make a living with medicine alone. So who would do this? Well, this is a guy who was born in 1882. He's fascinated with animals at age 6, graduated from medical school in 1908, so he's right in this period of time. He did lab work on nerve and tendon sutures. He was in the Army in World War I. When he got out, was very prolific with regard to papers involving hand and upper extremity issues. He was asked by General Kirk in World War II to set up hand centers around the country. And here he is teaching the examination of the hand of a serviceman. He wrote this beautiful treatise on surgery of the hand, beautifully illustrated, beautifully written. It's the first president of the Hand Society, and all the hand surgeons in the group know that this was Sterling Bonnell. So when I first put this talk together, it was for the Residents and Fellows Conference, I think in 2014. And as part of my research, I found out that Bonnell was never affluent. And actually, toward the end of his career, he had to call some of his own patients to settle up their accounts with him so he could keep his own finances in order. In 1965, Johnson signed an amendment to the Social Security Act that created Medicare. And physicians went crazy. They hated it. They said, this is going to be the start of socialized medicine in the United States, and that's not good. But what it actually created is several generations of affluent physicians, of which we are a part. Because all of a sudden you went from providing care and not getting paid from a lot of stuff to getting paid for almost everything that you did. And so if you look at orthopedics and you look at plastic surgery in 2024, this is these are the kinds of salaries that people had on average. And if you look at an aerospace engineer, 130,000, you look at attorneys, 286, administrators, 312, the only group of people in medicine that consistently do better than physicians are the insurance CEOs, and boy, do they do better. So what I would say to you that things are going to change as you enter your career, but people are always going to value your skill. You'll be compensated for that skill, and you should be compensated for extraordinary effort. So if you're a person who says, I'm going to do extra call, I'm going to do extra teaching, I'm going to go out of my way to make this work, you should be compensated for it. Because in any relationship, personal or professional, there is no greater poison than resentment. So if you're in a situation where you go, yeah, I'm doing extra, and there's no return on this for me, that generates resentment. And the return may not be money, it may be time, but there should be something for that. So what is your favorite song? For me, it's a tough pick. I do love jazz and blues. And I mentioned last night that I play music. My daughter is a legit musician. We had a chance to do a show with this guy, Huey Lewis. And this was a show that we did in Las Vegas as part of the Hand Society. And so I'm going to play some music for you. This is my Grand Rounds party trick. So I'll admit it's a little goofy. But the reason that I do that is that I can play those musical sequences in practice or in a performance over and over again, and I don't get tired of doing it. So it's one of those things where I can go down to my basement and shed for a few hours, and I was planning to do it for 45 minutes, and I look up and it's 3 hours later, okay? And so what happens to you when you are listening to music is it conjures up a great time or a memory. You relax, you smile, tasks are easier. Many of you will work out listening to music. Your brain actually changes when you're listening to music, and this is crazy, okay? So this is a study where they looked at how blood flow changed when you were listening to music. And what happens is that your nuclear accumbens and your ventral tegmental area both see increased blood flow when you're listening to music. Notice where this is. These are brain stem or very primitive centers of your brain, right? When music gives you the chills, the same areas are activated that are involved in emotion, reward, and even survival. How crazy is that, right? That music and areas of survival are linked. What I want to show you now is this video. This is a guy named Charles Lim, who I had a chance to meet, and he shared this video with me. This guy is a unicorn. So he, when I met him, was at Hopkins as an ENT surgeon, and he was also on faculty at Peabody Music Conservatory in Baltimore. So that's kind of a sick thing to be able to be faculty at two places like that. His research was on what happens to the brain when it's being creative. And so he studied jazz and hip hop musicians, and he would put them in a functional MR and scan their brains when they were either reading something or playing something that was written for them, or when they were improvising or freestyling. And so I just got to show you this because this is cool. I don't know if you're going to get to hear the sound on this or not, but. So this is a jazz musician in Baltimore. Charles designed a non-ferrous keyboard that could go into the scanner. So here's the keyboard. So now what they're doing is something that's called call and respond, where Charles would play a sequence, and then the musician would play whatever came into his mind. Not bad on your back in a scanner, right? So, but his research was fascinating because your prefrontal cortex is the part of your brain that keeps you from saying right now, Mark, this is boring. This is not a grand rounds presentation. I would rather be someplace else. Okay. So that lateral prefrontal cortex is what is sort of the self-monitoring part of your brain. When you are being creative, that shuts down, and what lights up is your medial prefrontal cortex. And that medial prefrontal cortex is self-expression. So I think of it as your brain unlocking when you're doing something that you really, really enjoy and you're being creative. And so it's sort of your sweet spot. And what I'd like to do now is give you my 5-step plan for finding that sweet spot in your practice and hopefully also in your personal life. And it's contract, flow, mastery, balance, and giving. So when it comes to a contract, there's two kinds of contracts. One is a contract that you get for your job, and the other contract is with your spouse or partner. And so this was a study that was done at MGH in their orthopedics department, where they looked at stress in partners of trainees and orthopedic faculty. So if there was psychological distress in one of you, 18% of your partners felt it, in faculty, 10%. Working spouses had a greater preponderance of feeling it. So you can see that for residents, it was 30%, and 13% for exhaustion. Dissatisfaction increased when people were tired, when they were irritable, when they were missing family events. Satisfaction increased when your partner liked their job, when you had a good sex life, and you had 90 minutes of quality time. 90 minutes. So Deidre, over what period do you think that 90 minutes was? A week. 90 minutes a week was protective for preventing psychological distress in your partner. So I really feel strongly about the fact that you, with your spouse or partner, you've got to define the borders of your own work. You have to find time that is protected so that you can do things like a meal, a movie, or a walk, respect for their work, ask questions, protect their time, encourage them, and never underestimate the power of a strong life partner. For work, most of you are going to be hired by a group that wants you to cover call wants you to put cases in their surgery center, or wants you to help them expand their footprint in the community. So to go to an area where they're not currently present. What is rare and what you have to look for is a practice that cares about your success, cares about you being there 5, 10, 20 years from the time that you start. And that requires a contract. And so last night we were talking about, you know, what I think is important in contracts. The very last thing that I talk about when I negotiate a contract for myself, or when I'm talking to the fellows about it, is what you want more than anything else is infrastructure. So if you're going to a practice that where you're not well supported, it cannot work. You cannot be happy and you cannot make good money. So you need infrastructure. Income is important. A voice is important. You have to find out whether or not you're going to have a say in how things work, whether it's a private practice or an academic, and there has to be a timetable for that. A voice is a big deal, especially now, for your practice, your community, and your profession. Has anybody heard Simon Talbot speak before? So Simon Talbot is a plastic hand surgeon who's talked about moral injury. And the concept of moral injury came up with Vietnam vets who came home after being forced to do things that were 180 degrees from their moral compass. And they struggled a lot with respect to that. And Simon and Wendy Dean have written about how that applies to people in medicine. And what he said is that physicians are smart, tough, durable, resourceful people. If there was a way to MacGyver themselves out of the situation by working harder, smarter, or differently, they would have done it already. And so many of the situations that you're in require you to advocate. I was the least involved, least political person in the world for a long time, and then really realized that I needed to have a voice, and all of you will need to have a voice, because what it does, it gives you a sense of agency, that you have some control over your environment, and that is important in your practice, in your hospital, regionally, nationally. Angela Davis said, "I'm no longer accepting the things I cannot change. I'm changing the things that I cannot accept." And I think that's a really big deal in 2025. You double dip when you get engaged, because you get what you and your colleagues need, some or part of the time. But the bigger deal is that it helps you hear, and it helps you hear. Because at a minimum, you're going to feel empowered, right? Another thing that is very important when you're looking at a practice is to find someone who you think you can rely on. And it only takes one person. So when you interview at a group, it's great if someone that from your program has already gone there and can tell you and say, yeah, I'm here for you. But if not, you need to say, is there one person who's going to have my back? And so this is a picture from 1 million years ago. This is Tom Hughes. Tom was one of our residents. He went to Brown for his hand fellowship, came back. He and I have worked together for 25 years. In 25 years, there's never been a time when I've said, Tom, I need help with something. Can you help me? That he said no if he was in town. And I've tried to do the same thing for him. And that is huge. So the second thing in my 5-step plan is flow. And so this is a picture of Freddie Fu. I went to medical school on a National Health Service scholarship. My expectation was that I was going to do family practice. When I got to the University of Pittsburgh, the big guns were the cardiothoracic surgeon, and I got starry-eyed. I said, "Oh, they're doing all this cool heart reconstruction and transplants on the horizon. This is something that I want to do." And my wife was one of my classmates. We were starting to get a little serious at this point, and she knew those guys were miserable. And so she said, "You know, Mark, I just did this rotation on orthopedics. They have all the tools that you have in your shop. You should check it out." So I changed one of my rotations from anesthesia to a 2-week ortho rotation. And I met Dr. Fu. He was in his second year in practice. And there was one day where we operated until about 6:30. We go up on the floor to make rounds. as we're leaving the ward, a custodian comes up to Dr. Fu and said, Dr. Fu, my knee has really been bothering me. And he said, sit down. Examines his knee. He goes, you'll be in my office tomorrow, 6:30. And so the guy said, Dr. Fu, thank you so much. And so we're walking down the hall, and he stops in the middle of the hallway and he goes, I love orthopedics. I'm like, oh my God. I never had a cardiothoracic surgeon say, I love cardiothoracic surgery. So he single-handedly flipped my life, pivoted my life, because he's so passionate and so excited about the work that he was doing. So the Buddhists call this Wu Hui, and Wu Hui is a situation where you're doing without doing. It's something that doesn't involve struggle or excessive effort. Shazang Mihaly was the chair of psychology at the University of Chicago in the 70s, and they were studying, and he coined the term flow. And so this came from their study of artists who became so immersed in their work that they, family might have to say, hey, listen, you haven't eaten for 2 days. And so this is Michelangelo, and he was commissioned by Pope Julius II. And this is one of his sketches of fresco that he was doing. And then this is the work in the Sistine Chapel where the conclave was just concluded. There were 6 elements of the flow experience. It was intense focus. It was merging of action and awareness. You weren't self-conscious. You controlled the activity. There was an altered sense of time. And the activity in and of itself was intrinsically rewarding. And in that moment, you lost yourself, okay? So this is Sheikh Akena Mason. He was the first person of color to perform in a royal wedding. It was for Harry and Meghan's wedding. And then this is him performing in concert. And there's no question that he's lost in that moment. When my kids were in middle school, my wife gave me this article by Malcolm Gladwell. At the time, he was sort of an unknown science writer for the New Yorker. And he wrote this article called The Physical Genius. And what he was interested in was people who had an affinity for translating thought into action. So he studied 3 people. The first one was Wayne Gretzky. Wayne Gretzky, when he was 2, was given a hockey stick and a tennis ball by his parents. And he would go down into the basement and drill that tennis ball up against the wall until his parents would lose their mind. And they would say, yeah, we're taking the stick. You got to go to bed. Okay. The second person was Yo-Yo Ma. And Yo-Yo Ma, in a similar fashion, was just consumed with writing, practicing, performing. And then there was Charlie Wilson. Charlie Wilson was a general surgeon at UCSF, and was on every other night call. On his off nights, he'd go to the micro lab, and he would spend hours in the micro lab. Was just completely fascinated with that. He ended up learning, didn't invent, but learned a technique of transsphenoidal pituitary resection for pituitary adenomas. If you suffered with one of those, gigantism, messed up endocrine system as a result of pituitary adenoma, prior to that procedure, you get a craniotomy, they push your brain to the side, they try to dig out this adenoma, and you'd be worse off than you were beforehand. So he perfected this technique, and based on the skill that he had derived and the love of doing microsurgery, ended up teaching the world how to do this procedure. When you think about, and when Gladwell talked about how you became a physical genius, obviously you had to have aptitude, and all of you have that aptitude. But he said, you know, what was it about these people that allowed them to practice these tasks over and over again to reach such a high level of competence? And he said, you know, it must be like this flood of neurotransmitters that bathes the brain that allows this to happen. And when I heard this, I thought, you know what, that's like a brain tickle. And what I would say to you is try to find your brain tickle. Losing yourself in work, I asked 10 past presidents of the Hand Society, and they said doing pulsations, fractures, teaching in the OR, connecting with patients in the office, writing and editing. I asked your faculty, and I was teaching residents, hip preservation, SEMLS procedures, being in the clinic, cases that are challenging but manageable, busy clinic and elbow trauma. And when I asked you guys, it was new techniques and approaches, teaching, getting to know attendings, being in the OR and doing D-scopes. The third thing in my 5-step plan is mastery. And so mastery and flow are inextricably entwined, because you can't get in a flow state unless you're pretty good at something, and you can't master something unless you find yourself in that state. And so again, Gladwell talked about the 10,000 hours. And I will tell you, it took me more than 10,000 hours to get good at some things that I really like doing now. It's going to be different for every person. But what it talks about more than anything else, I think, is a commitment to your craft. So all of you have excelled in other things. The only way you excelled in that was a commitment to that craft. In 1987, I was a first-year ortho resident. And I was making rounds with this guy, Ed Hanley. He was my interim chair. The guy on the right is Albert Ferguson. He was the person who accepted me into orthopedics. And he stepped down, Ed took over. And I'm rounding with him, and he goes, "Barrett, what do you like?" I said, "I don't know, Dr. Hanley. There's a lot of things that I think are kind of cool. I think hip surgery is kind of cool. I think sports is cool." And he said, "Be good at something that most others can't do." So if you look at the hard stuff in upper limb surgery, it's micro, soft tissue reconstruction, difficult non-unions, nerve reconstruction, and complex peds problems. There's 5 parts to mastery. There's the technical skill that's involved in it. There's talking with patients and family, curiosity, honesty, and doing the right thing. So being a master in the clinic, every patient has a story. And I'll tell you that I can't listen to them all, but I try to listen to most of them. And in particular, I try to listen to them when I think it's going to have a significant bearing on their care. Curiosity, evaluate your practice and challenge conventional wisdom. Honesty. Right? This is a look that we've seen before. Okay. There's a wonderful book that's out of print now that's called Betrayers of the Truth. And Broad and Wade examined scientists who, over the ages, had fudged their data. And so Galileo fudged some data that had to do with astronomy that set back the study of physics several centuries. We know that Mendel came up with this perfect 3-to-1 ratio that was impossible to have achieved. And then there's John Darcy. And John Darcy in the 70s was the #1 recipient of NIH dollars in the country. He was doing cardiology research, and he was lying about his work. And then there's Elizabeth Holmes. So in 2014, the youngest self-made female billionaire. And obviously, her aspirations were built on a lot of falsehoods. And we know how that turned out. So it's easy for us to sit here and say, well, that's them, that's not me. Scientists do that, and people in business do that. But that's not my life. But it's all a matter of degrees. And I would say, resist the temptation to overstate your experience, overinflate your outcomes, overbill, and be circumspect with your relationships, particularly with industry. Doing the right thing, it's the ED consult at 2 a.m. where we think he may have a compartment syndrome, and you know the person does not have a compartment syndrome, but you got to get your butt out of bed and look at it. And the questionable septic joint in a diabetic at the end of a Friday clinic where you go, oh, gosh, it's my kid's birthday this evening. The last thing that I want to do is take this person to the OR. The cadet's prayer is make us choose the harder right instead of the easier wrong. So the 4th thing is balance. And there are 3 parts to balance. There's reflection, reinvention, and recreation. And balance sounds easy, but it is not. So I was the person in college, medical school, residency, and fellowship who could fall asleep anytime, anywhere. And I had insomnia in my first 6 months of practice. And I was really embarrassed by it. And I waited about 6 weeks until I was really struggling to tell my wife about it. And she said, you need to talk to somebody. I go, I'm talking to you. She goes, no, you need to talk to a real somebody. So I went and I talked to a psychologist, and she said, well, what do you do? I said, I'm a doctor. She says, is that stressful? I said, no. She said, what kind of doctor are you? I'm a hand surgeon. She goes, well, you have to take a lot of call with that. I said, well, I take everything I call. She says, is that stressful? I said, no. Do you have a family? Yes. Children? Yes. What are their ages? I said, I have a 6-year-old and 2 5-year-olds. Is that stressful? No. And in reality, none of those things were stressful because I had worked it out. I did a residency where we just operated it. We were rarely in clinic. And so what I had started in practice was manageable, except what I didn't know is I didn't know how people did after little elective stuff. So if one of my big traumas came in, I was good with, okay, this should be this should be this. Somebody came in after I released their first extensor compartment and they were numb, I'd be like, oh my God, did I cut their radial sensory nerve? And I would lay in bed looking at the ceiling saying, I'm going to see this person tomorrow. Is that nerve going to be any better? Did I hurt them? Did I make them worse off than when they came in the door? So I tortured myself over a lot of little things, but then there's the inconceivable mistake. And so I want to read you this. I checked on him this morning. So it's from one of my former fellows, an email that he sent. 8 hours post-op, has ulnar nerve symptoms with dense numbness and hand intrinsic weakness. He has a partial PIN palsy. It's killing me inside. I've learned through this case and a couple others in the last few years that I don't take failure and complications that well. I'm hoping that it all improves. I know I shouldn't beat myself up, but it's hard not to. Can't thank you enough for your help through this. I hate to call it tough time, but it feels that way. So humbled right now. I'm not used to letting things keep me up at nights. I'm trying to remove myself from the patient's clinical scenario and make logical decisions. That's part of the reason I'm reaching out to you with these questions. So when somebody sends me one of these emails and I call them, the very first thing that I say is there is nothing good about this. Nothing. Anybody tells you that there's a silver lining here, there is not a silver lining, okay? But what we do have to remember is that it is not about being perfect. So I cannot remember in the last 34 years ever evaluating a patient perfectly or ever doing an operation perfectly. I'm 0 for 1 scabillion, okay? But it's not about being perfect. It is about managing our imperfection. So when something goes wrong, dialing up and using everything that we have at hand, including phoning a friend to work through this. Balance requires you to be reflective in this moment, and you have to figure out what you've done, why you did it, a way to avoid repeating this mistake, and importantly, how to forgive yourself. When I was a resident and a fellow, I was taught that you should never apologize to a patient. And now I apologize all the time. I'm sorry that I kept you waiting. Thank you for your patience. I'm sorry that this isn't turning out the way we both expected. And the analogy that I'll give you is that if your car isn't running right and you take it to the shop and they have it for 3 days and then you go back and you pick it up and it seems like it's doing pretty well, and then a few miles down the road it starts doing the same thing. If you take it back to the service manager and he goes, so were you speeding? Did you hit some potholes? What's your response? You're gonna be pissed off, right? If he said, oh, well, I'm really sorry. We're gonna look at this again. We're gonna do everything that we can to get this car working the way it was before it started giving you trouble. All of a sudden, you realize that his interests are aligned with your interests and you relax. There's balance from reinvention. So this is a picture of Glenn Gaston and Brian Loeffler at my farm. So I had asked the two of them to come and teach us about TMR, targeted muscle reinnervation. And Glenn showed the starfish procedure where he, in a partial hand amputation, he rearranges intrinsics and gives more nodes so that you can have a more complex prosthesis to read those electrical nodes. And it was a great visit, and I asked him if I could come down and spend some time with him. And so I went to his clinic, and this was a picture with one of his patients who had a partial hand transplant. The guy said, I just want to play some basic guitar. Doesn't have to be a lot, just something basic. Came in, brought his guitar into clinic, played us a little something. Guy was thrilled. And then look at Brian and Glenn. Okay. So I know Glenn Gaston because for a long time I took care of pro athletes, and he and I were always on the pro athlete panel at the Hand Society. And Glenn was a young Turk who wanted to be the person for athletic hand injuries in the world. And he was really good at it. When I showed him this picture that I took, I go, Glenn, look how happy you are in this picture. And he goes, if you had told me 15 years ago that I would get my greatest joy from taking care of amputees, I would have said you're crazy. But for him, that was the special sauce, the pivot that made a difference to him. Balance requires recreation. That means to create again or renew. And no one can define the yin to your yang. But being able to manage the stress of your job, which is a stressful job, requires strategies. And they studied resilient strategies and experienced physicians, and those people who were resilient in stress had work that was intrinsically satisfying. They set limits and planned fun things. They reflected upon and accepted their limits. And so for me, 16 years ago, I bought this old dairy farm, and it is my happy place. It's something that I really enjoy sharing with my grandkids, my family. It's a fun thing for me to share with our fellows and their families. And that's the crew for this year. I asked your faculty about it, and Dr. Baleka, her time in the gym, running, skiing, being out on a boat, playing some very intense pickleball, some old school tennis. Look at that wooden racket. And some jujitsu. And the same personality, but no, they're not the same. Yeah. I asked you guys about it, and it was family time, running, car stuff and family stuff, breaking it down, right? I'm so jealous. And this was my favorite. So I get this picture, and it says, I enjoy spending time with my dog, playing golf and football. And then I get this picture of this exceptionally attractive woman with no mention. I mean, what is up with that? I asked senior hand surgeons with greater than 35 years of experience, the cycling, dinner with friends, and Puccini opera. This is Lee Osterman in Biking in Tuscany. This was Terry Light in his restored MGBGT in the back roads of Michigan. And then the person that I want to be when I grow up is Peter Stern. And so Peter Stern always has an explanation for everything. And he said, Mark, what you need is you need a civilized sport. And a civilized sport is a beautiful spot where you have friends and family and you lose yourself. The other thing that Peter Stern told me is that when you're taking a picture of a fish that you caught, if you want to make it look big, you hold it out like this. Okay. So the last thing in my 5-step plan is giving. And there is a time and a place for this. You right now cannot give more than you're giving. You just can't. You're being pulled in a lot of different directions. You're trying to cultivate your interests, your skills. And so giving beyond this is a big challenge. There are infinite forms, though. There's family, there's community, and professional societies. And there's giving through guidance. So you're doing that already. You're doing that with junior residents, and you're doing that with medical students. That's a big deal. And it's important because young physicians crave your time and they crave your advice. And I was really lucky because I had up in the top left here, Mel Rosenwasser, for reasons that I don't know. All of these people kind of plucked me out of the crowd and put their arm around me and said, yeah, you know, I'm gonna help you out. It was Mel, it was Ed Ackelman, Jesse Jupiter, Peter Stern, Doug Hannell, Mike Houseman, and Lee Osterman. And Pericles said, what you leave behind is not what's engraved in stone monuments, but what is woven into the lives of others. So I have a close friend named Scott Cozen who works down at the Shrine in Philly. And Scott was on me for years about going with him on a medical mission. And I had a million reasons for not going, and they're all good reasons. I had little kids, my practice was busy. I couldn't tell my wife that I was going to take a week away without her or without them when I was already away doing work and lecturing. But it is a big deal. So our late Pope said that we should allow ourselves to be touched by others' pain. And it is very profound. We talked about this last night, where a lot of these kids that live in huts that are heated by an open fire will get up to go to the bathroom in the middle of the night and will fall into it and burn both hands and one side of their face. It is also a wonderful time to connect with other people from around the world. This is Paco Saldana from Spain, Miguel Cruz, and Carolyn Engel from Canada. This is one of my favorite pictures. It's on the far right is Scott Cozen. I'm in the middle. This was an elbow case that we were doing in Haiti. And Scott Cozen, I can't teach him anything about anything having to do with kids, but I do have an interest in peds elbow. And I showed him one little thing in the operating room having to do with a peds elbow. I was so proud of myself. This is another one of my favorite pictures. So this is in Guatemala, and it's about 8:30 at night. And I want you to just take a minute and look at the faces here. So we had started the day at about 5:45. It was 8:30. And what you see is you don't see a tired face in the group. And the reason you don't see a tired face is that this is the purest form of medicine. There's no epic, right? People come in, they say, can you help my kid? You say, I think I can. You do it. You provide some post-operative care, and you feel good about yourself. You feel like you've done something that's productive. This is a picture of Scott Cozen with Mike McCashin. We were at Haiti. It was the first case that we were doing. I said, Mike, go in there and scrub with Cozen. It's going to give you a chance to talk. They ended up scrubbing for like 25 minutes. And this picture that I took was both of their screensaver for about 5 years. When you go and you do these missions, it's your job to put yourself out of business, right? You don't want to keep going back there year after year. You want to help the community take care of themselves. So this was in Haiti, and we took a day off. These are some Haitian orthopedic residents. They showed us some cool cases. We showed them some cases. And you know, that I think is a super important part of this. And another important part is getting time with somebody that you care about and doing something that is meaningful to both of you. So I'm just going to finish up by telling you something that I really, really believe. I believe that in each of you is a unique gift, part of your physical genius. You should cultivate, you should practice, and you should hone that skill. You should do it regardless of naysayers and regardless of external distractions. Pen your own story and write your own song. Thanks. Nobody ever has questions after this talk. But a lot of people have comments. So any perspectives that I'm missing here?
Much of a big faith to buy a big farm.
Not at all.